Hello and welcome to the channel. My name is Jenna Nikina. I'm a retinal surgeon and an ophthalmologist working in England. And I wanted to talk to you about, us ophthalmologists, because I thought it would be interesting for people to hear how we work, how we're organised, and also to explain some of the things which sometimes are confusing when you come to an eye clinic. So first things first, an ophthalmologist looks after the health of everyone's eyes, and it's a different specialty to the optometrists. And so optometrists is an entirely different specialty that they learn about prescribing glasses, they learn about dealing with minor eye conditions, and it's a separate degree that looks specifically at those aspects. Whereas an ophthalmologist is a doctor who undergoes medical training, general medical training, and then subspecializes just in eye health. And some of the confusion, I think, comes also from different systems around the world, because certainly in some parts of the world, ophthalmologists will also do a lot of the refraction work, as we call it, so testing for and prescribing glasses. And in some parts of the world, very few ophthalmologists are actually surgeons, and most of them do sort of primary care, looking after minor eye conditions and glasses prescribing. In England specifically, most of us will not do the refraction aspects of the work, so we'll rely on our colleagues optometrists to do the glasses prescribing, and we'll look after eye health solely. Within the ophthalmology world, there are actually quite a few subspecialties. So myself, for instance, I'm a retinal surgeon, so I will deal with things like retinal detachments, epiretinal membranes, macular holes, and operate on retinal conditions. Other subspecialties in ophthalmology include a medical retina, which I also am involved with, so that's looking at macular degeneration, diabetic care, diabetic retinopathy, vascular occlusions and things like that. There's uveitis, which is inflammatory disorders of the eyes. There's oculoplastics, which is to do with the skin and the eyelids and also the tear drainage systems. There is cornea, which is front of the eye, and the anterior segment. There's glaucoma, which deals with eye pressures and the drainage of eye fluid. Pediatrics, of course, looking after children's aspects. There are also more niche, smaller subspecialties such as genetics and other aspects which are sort of more present in tertiary centres. But we all work together, we all help each other. But sometimes people wonder why one part of the problem has not been addressed when they come to the clinic, and you need to explain, well, actually, I'm looking after this small part of the eye, and my colleague in another clinic is going to sort out this other small part of the eye. But we all talk together, and actually there's good evidence to show that if you subspecialize and look at a smaller aspect of the eye, you become more skilled in that area because you're seeing more of it rather than being a generalist. So I think that's why historically we have split up into the different disciplines.